Hello, everyone, and thank you for joining us today for our Live Well Advanced Pre-Conference session. We are going to be discussing California Advancing and Innovating Medi-Cal, or what is commonly referred to as CalAIM. My name is Heather Summers, and I am the Deputy Director for the Medical Care Services Department with the County of San Diego Health and Human Services Agency, and I lead the San Diego Advancing and Innovating Medi-Cal or SD-AIM unit, as we commonly refer to it. Today, I'm excited to be joined by Lynn Carr, the Chief of Agency Operations, and Allison Sipler, the Program Coordinator for the SD-AIM unit. I'm going to first briefly talk about what the session will entail. First, I'm going to give an overview of Medi-Cal and CalAIM. I will also share a CalAIM success story. Then Lynn will discuss the key components of CalAIM and the new benefits, services available for Medi-Cal members with complex needs. Lynn will also cover how to access these services and how you can learn about our local CalAIM service providers in the county. Allison will also share information on the role of our county's SD-AIM unit. And then I will close with some information, resources, and how you can learn more. I wanted to discuss Medicaid and Medi-Cal today with you. Medicaid is a government health insurance program that provides coverage to low-income individuals. Medicaid is administered by each state within broad federal guidelines, which are subject to oversight by the Federal Centers for Medicare and Medicaid Services, known as CMS. Medi-Cal is California's Medicaid program. The state's Department of Healthcare Services administers Medi-Cal in California and contracts directly with all the healthcare plans. Medi-Cal provides coverage to all individuals who meet eligibility criteria. Through federal and state approval, CalAIM was added to the contracts with the health plans in January of 2022. In San Diego County, Medi-Cal provides health insurance to well over 1 million people, or almost 1 out of 3 San Diegans. And since 2011, Medi-Cal members in San Diego County have increased nearly 200%. Statewide estimates indicate that 5% of enrollees with the highest cost or most complex needs account for over half of Medi-Cal spending. California Advancing and Innovating Medi-Cal, or CalAIM, is the state's transformational plan to modernize the Medi-Cal program. It was designed to improve the quality of life and health outcomes of Medi-Cal members, with an emphasis on those individuals with the most complex needs. CalAIM has 3 primary goals. First is to use a whole person care approach to address both medical and non-medical factors that influence a person's health. Second, improve quality outcomes, reduce health disparities, and transform Medi-Cal. And lastly, make Medi-Cal less complex and more flexible. CalAIM includes a new benefit called Enhanced Care Management, also referred to as ECM, and community supports. Next, I'm going to share a most recent success story from the County of San Diego. As the County of San Diego is seeing the impact of the CalAIM Enhanced Care Management benefit on the lives of the most vulnerable children and youth. In a recent success story through a program offered through the county called California Children's Services, or CCS, the county provides medical case management services, which includes physical and occupational therapy. CCS offers care to children with chronic, disabling, or life-threatening conditions. Children enrolled in CCS have both medical and social needs beyond what our county program can offer. A youth served by CCS, who we will call Jane, recently moved with her family to a new home and school district. Jane received enhanced care management through her Medi-Cal plan. Similar to all teens, Jane struggled with the move, including adjusting to a new home and high school. Jane has type 1 diabetes, and to fit in at school, she was not taking proper care of herself. Jane's pediatrician and medical care team reviewed her care and suggested enhanced care management, or ECM, to assist with overall care coordination and social supports so Jane could manage her health condition. The CCS case manager referred Jane to ECM, and she was assigned a lead care manager. The ECM lead care manager worked with her parents to assist with transportation needs. They also provided patient education on the importance of diabetes control and assisted Jane in how to manage her blood sugar. This allowed Jane to take better care of her and her health. The lead care manager connected Jane with an in-home behavioral health therapist to assist with the stressors of moving and changing schools. The lead care manager also worked with the family to obtain the medical supplies needed to monitor and treat her diabetes. Jane, her family, and the lead care manager developed trust quickly, and when Jane identified a potentially serious medical complication, she reached out to her lead care manager, who immediately connected them to medical care. That quick response avoided a potential hospital stay and assisted Jane and her family with tools to better manage her health and her well-being. And now I'm going to transition over to Lynn, who will talk more about the components of CalAIM.
Thank you, Heather. There are several components under the CalAIM umbrella. Today, we're going to focus on the first two initiatives listed on this slide: Enhanced Care Management, which we'll be referring to as ECM throughout today's session, and Community Supports, referred to as CS services. I also want to take a moment to mention the Justice Involved initiative under CalAIM. On January 26, 2023, California was approved to be the first state in the nation to expand Medi-Cal services for individuals in state prisons, county jails, and youth reentry and detention facilities for up to 90 days prior to release. This will help ensure eligible individuals are enrolled in Medi-Cal prior to release and allow for in-reach and coordination of services as individuals re-enter their community. Now I'll take a moment to talk about enhanced care management. ECM is intensive care management for the highest need Medi-Cal members. ECM services are provided by community-based organizations who are contracted with our local Medi-Cal managed care plans. Medi-Cal members who receive ECM services are assigned a lead care manager who provides intensive care coordination. The lead care manager will meet the Medi-Cal member in the community, wherever they are, on the street, in a shelter, in their doctor's office, or at their home, and complete a full assessment to identify needs. The lead care manager will coordinate care and provide linkages to healthcare and community services, which includes helping arrange appointments and transportation for mental health and primary care appointments. These services are designed to support the member as well as their entire family. Next, I'm going to talk about who's eligible for ECM services. ECM went live for certain populations in January 2022, which includes individuals and families experiencing homelessness, adults at risk or for avoidable hospital or emergency department utilization, and adults with serious mental health and/or substance use disorders. In January 2023, adults living in the community and at risk for institutionalization and individuals eligible for long-term care institutionalization went live. In July 2023, eligible children and youth populations went live. And lastly, in January 2024, pregnant or postpartum individuals who are subject to racial and ethnic disparities are eligible, as well as adults and youth transitioning from incarceration will go live. This slide displays additional eligibility criteria based on who is and is not eligible for ECM to help prevent duplication of similar services. For example, members who are enrolled in fee-for-service Medi-Cal are not eligible for ECM. Members must be enrolled in a Medi-Cal managed care plan. In addition, if a member is enrolled in a program such as Multi-Purpose Senior Services Program, MSSP, or a PACE program, they should already be receiving care management and therefore would not be eligible for ECM. If a member is receiving services through programs such as MSSP, PACE, or complex case management, they may switch to ECM. Members may contact their health plan if they have any questions on what services they are eligible for and what programs would be best to meet their needs. To refer a member to ECM services, we have included a link to the referral forms for each of the Medi-Cal managed care plans, as well as where to submit the referral form to. This information is on the SDAIM website, and the link is in the chat. Now I'm going to talk about community support services. Community support services are designed to be provided in the community to improve health outcomes. They are services that were not historically covered by insurance, and our local Medi-Cal health plans are not required to provide them. However, they are strongly encouraged to. Like ECM, they are also provided by community-based organizations who are contracted with our local Medi-Cal health plans. A member does not need to be eligible for ECM to receive CS services. There are 14 total services, which includes housing transition navigation services, housing deposits, housing tenancy and sustaining services, short-term post-hospitalization housing, recuperative care, respite services, day habilitation programs, nursing facility transition or diversion to assisted living facilities, community transition services or nursing facility transition to home, personal care, home modifications, medically tailored meals, sobering centers, and asthma remediation. For more details on each of the 14 community supports, please refer to the CS policy guide, and we'll make sure to put the link in the chat. Now I'll share how Medi-Cal members can access these services. Similar to ECM services, each plan has a referral form and a designated email or fax number to submit the community support referral form to. This information is also available on the SDAIM website, which the link is in the chat. If you are interested in learning who are local ECM and CS service providers, 211 San Diego has created the CalAIM Provider Matrix, which provides a list of the current organizations contracted to provide these services. The matrix linked on this slide, and we'll drop it in the chat, includes the name of the providers, their contact information, the services they offer, and what health plan they are contracted with. If you have any questions about eligibility or services, we have included the member service number for each of the health plans. Now I'm going to turn it over to Allison to discuss the County of San Diego's role in CalAIM.
Thanks, Lynn. The success of CalAIM depends on strong coordination between state and local government agencies, managed care plans, hospitals, community-based organizations, service providers, consumers, and advocates. To ensure that the statewide CalAIM initiative and services are successfully delivered here in San Diego, the Health and Human Services Agency established SDAIM, San Diego Advancing and Innovating Medi-Cal, as a specialized unit within medical care services that supports other county departments and external partners to implement CalAIM locally. The SDAIM unit was formed in July 2022. The goal of SDAIM is to establish a cross-sector collaborative approach to improve San Diego County's wellness delivery system that ensures coordinated and equitable access to quality health and social care for Medi-Cal members. Please visit the county's website at the links provided for more information and to view the roadmap, which I will describe in the next few slides. The SDAIM roadmap was developed to guide local CalAIM implementation, to align county and regional priorities, and to foster coordination and collaboration among partners. Through a community engagement process, we were able to identify 7 unique roles for the county to advance its commitment to equitable access by facilitating countywide response to service delivery issues, promoting streamlined and standardized processes, cultivating collaborative partnerships, disseminating information, fostering data sharing and infrastructure, elevating consumer-driven needs, and advocating at the regional, state, and national levels. Now we'll review the SDAIM priority areas. The county's SDAIM roadmap outlines 4 priority areas on how we will support our community. The first priority is care coordination. This includes promoting streamlined processes for member identification, referrals, and authorizations, and strengthening care transitions. The second priority is enhanced care management and community supports. This includes assessing countywide services capacity and identifying gaps, as well as securing funding for capacity building and infrastructure. The third priority is safety net. This priority focuses on strengthening social and clinical care resources and engaging community partners. And the fourth priority is Medicaid innovation. This entails identifying new service delivery models and best practices, driving policy and procedure enhancements, and advocating for policy changes. The roadmap is intended to be a high-level guide that leads to actionable steps and impacts. And now I'll pass it back to Heather, who will tell you about how to get involved and share some key resources.
Thanks, Allison. So if you would like to participate in local collaborative planning efforts, the San Diego County Path Collaborative Planning and Implementation, otherwise known as CPI Group, is charged with the following. They are charged with facilitating monthly convenings and working collaboratively to develop programmatic activities, identifying enhanced care management or ECM and community supports called CS needs and gaps within the community. They are also charged with identifying and resolving implementation issues and monitoring how PATH funds can be used to address implementation issues and disseminate best practices. If you're interested in joining, we've posted the registration link in the chat. We've also compiled a list of CalAIM quick links. This contains a variety of additional CalAIM resources. And we will also post this slide deck on our SDAIM website. So you will also have access to all of these links. These are items, resources, and materials that our team frequently refers to. So once that deck is posted on our site, you will have them at your fingertips as well. And I wanted to thank all of you for joining us today at our Live Well Advance pre-conference. And we hope you've enjoyed today's presentation. And as a reminder, all of today's presentations will be posted on the Live Well San Diego YouTube channel shortly. We look forward to seeing you in person tomorrow at our 2023 Live Well Advance and School Summit. The event will bring thousands of partners and stakeholders together to network, learn about new tools and best practices, and participate in breakout sessions. And as always, you can learn more about Live Well San Diego at www.livewellsd.org. Once again, thank you for being here, and we hope that you get involved with Live Well San Diego. And we also hope you have a great rest of your day.